Hi, I'm Mark.
And I'm Andrew.
We're here today to tell you about some rehab and prehab exercises for low back pain. This presentation is designed to help your clients understand their pain better so they can participate in their own recovery.
Simply just too many potential causes for acute low back pain to cover in this video, so we're just focusing on the mechanical chronic low back pain. This includes strains, sprains to muscles and ligaments of the lumbar spine, facet joints, and in some cases, the sacroiliac joint. It is extremely important to help clients understand the role that they can play restoring the pain-free function of the hips, pelvis, and lumbar spine.
As RMTs, we have to prescribe REMEX that are simple and efficient because compliance to a well-designed REMEX program is the limiting factor in how much it contributes to recovery. We have to work with each client individually to come up with some exercises that are appropriate for their fitness level, are effective at restoring functional length-strength relationships between force couples, and are interesting or fun enough to maintain compliance long enough for the remedy to take effect. Before we get to the exercises, let's review why good postural alignment is so important for clients with low back pain. Let's consider just one of the most common sites of pathology leading to low back pain. The center of mass of the body is usually located roughly at the vertebral level of L5-S1. This joint is the largest, most load-bearing vertebrae in the spine. It's also the joint of transition between the mobile segments of the spine and the stable sacrum. The angle between L5 and S1 is greater than between the other vertebrae, and the spinal joint moves more than the other spinal levels. When lifting an object 14 inches anterior to the spine, the load on the L5-S1 disc can be calculated to be roughly 10 times the weight of the object. Andrew's going to demonstrate for us. He's going to be picking up this crate and holding it roughly 14 inches in front of him, roughly 14 inches anterior to the spine, so a little bit out away from him where his hands are. If this object were 20 pounds, the additional load to his L5-S1 disc would be 200 pounds. If this was 5 pounds, it'd be a 50-pound additional load. As we can see, mechanical forces at this joint in the body can be extreme, and there are structural risk factors at play. However, having strong abdominal muscles, according to McGee, reduces loading on the lumbar spine by 30% and on the thoracic spine by 50%. So having weak abdominal muscles predisposes someone not only to hyperlordosis, but hyperkyphosis, and causes a force couple imbalance with their antagonists of lumbar flexion, the lumbar erectors. Restoring balance in this force couple is essential for rehabilitation from low back pain.
Hyperlordosis correlates strongly with the loss of neutral pelvic alignment, which Janet and Joel describe the terms as the loss of muscle imbalance, and is called the pelvic cross syndrome. Specifically, they noted that the phasic, abdominals, and gluteus maximus muscles are weak, long, inhibited, and the postural iliopsoas and lumbar erectors were hypertonic and shortened. The situation predisposes people to pathologies of the structures of the low back causing pain.
Low back pain that lasts longer than 3 months is considered chronic and leads to deconditioning syndrome, which is defined by McGee as a loss of muscle strength in the low back and trunk, which leads to impaired motor control, which leads to loss of coordination and posture control. So how can we reverse this process? By reconditioning the weak muscles of the low back and stretching the short ones.
The REMEX that we're going to demonstrate today are designed to gradually restore and critically lengthen, strengthen the relationship between the force couples, in which that helps stabilize the lumbar spine and gradually reduce the symptoms and correct the pathologies of the mechanical low back pain. So now we're going to demonstrate how we do isometrics for TA. Can I ask you to sit on the table for me, please? So the first step of triggering TA is in order to do your Kegels. And how do you do your Kegels? Is to simply just hold in your P. Do that a couple of times. And that'd be step 1. Any pain?
No.
Okay, so we're going to proceed to step 2. Step 2, can I ask you to lie prone? Supine, please. Step 2 in Merle's guide is essentially what we're going to do is we're going to really make sure that we trigger TA. So if I can ask you to have your hips flexed and your knees flexed and having your feet on the table at the same time, like so. What we're going to do now, and to demonstrate that, one leg at a time, we will start with your right leg, the one I'm touching right now. I want you to simply just slowly let your leg go into straight leg. So taking your time, letting your foot slide off the table without having any outpouching over here on your abdominals. And slowly bring back that contraction back to neutral site, as well as the other leg. Any pain with that whatsoever, sir?
No.
Perfect. So we're going to move towards step 3. And step 3 is now a dynamic contraction of TA. And in order to contract TA from the 3rd level, is now I want your legs completely off the table, still in that flex form. So I'm going to push you into, like so. Can you hold that for me? Mm-hmm. Now one leg at a time, what I want you to do, we'll start with your right leg first. I want you to now, same thing as step 2, as you're bringing your leg out straight, I want your leg to go straight as well, without contracting abdominals. And back up. Perfect. Any pain with that, sir?
No.
Perfect. So can I ask you to be seated back up for me, please?
Yep.